Curious about LASIK? Wondered if it's right for you? Dr. Chebil is here to answer our questions on LASIK eye surgery. I'm Anita, and this is Care Experts. Today we're talking with Dr. Alexandra Chebil, our Harvard-trained, board-certified ophthalmologist, who's an expert on today's topic, refractive laser eye surgery. Thank you so much for joining us today, Doctor.
Thank you, Anita. Thank you for having me.
Yeah. So let's get right into it. What exactly is laser eye surgery?
Laser eye surgery is a procedure that's been around for about 30 years. Way back 30 years ago, if a child was told they had to have glasses, it was a life sentence. They were stuck with glasses forever. So it is a technique that has evolved over the past few years. We can treat nearsightedness, farsightedness, and astigmatism all together and hopefully get rid of your glasses and contact lenses permanently. It's a life changer.
So what kind of results should a patient expect after LASIK? Will they be able to see 20/20?
Well, short term, the vision is a little bit blurry. You have to see that it is eye surgery. It's not like putting on a pair of glasses. So your eyes have to take a normal time to heal. For the first few hours, it's going to feel a little scratchy, burning. Everybody I've treated going back 30 years ago has been able to at least get driving vision on day one. Driving vision is 20/40 according to the DMV. Most people get 20/20. If it's not the first day, then certainly within the first week or so. It all depends too on how high your prescription is. If you get in a very high range, like over 4, some people I've treated have Coke bottle glasses. They're in -12, never -14, and those folks can take a couple of months to get the full 20/20.
So walk us through the procedure.
First of all, a patient has to come in to see if they're even qualified. That's the first step because we want to make sure that your prescription is stable. You have to be over the age of 18. That's an FDA requirement. And you have to be within the treatable range. So we really have a high range of vision that we can fix. Nearsighted people, we can treat up to a 14. Farsighted people up to about a 6, and then astigmatism up to about a 5. The numbers have to be treatable. Other criteria, you can't have a really dry eye. You have to have the cornea, the surface of your eye has to be nice and smooth, and you have to have good overall health. Those are the criteria. So that's the first step, making sure you're a candidate. You lie down under the machine. I put a lot of numbing drops in. I hold your eye open. That's the most important thing. You have to stay still. The actual laser time is somewhere between 20 to 40 seconds, depending on how high your prescription is. All the patient needs to do is look up into the machine. There's a blinking red light. It's called a tracking light. So it's kind of like the missile-guided tracker things that you see on Top Gun, where you're locked on target. So the patient is looking up at this red light that's moving. If the patient moves, the light moves. It tries to find where your eye is.
Got it.
And that gives you the best possible vision.
So how long does it take? I guess you have this first initial consultation, but then if you are a candidate, how long does the actual procedure take?
After the consultation, the actual procedure only takes about 20 minutes. You have to see that if you're wearing contact lenses, they need to be out of your eyes for a minimum of 1 week to make sure the surface of your eyes is stable and healthy. But the actual treatment is 25, 30 minutes tops.
Now, is the procedure uncomfortable or painful at all?
The numbing drops are really strong. We don't give any shots or anything like that. We do give you a little bit of Xanax if you feel like you're nervous. The actual treatment, you feel a little bit of pressure at one point. And I talk to patients during the treatment. I walk them through it step by step. I say you're going to see a light. You're going to feel a little bit of pressure. The light's going to go dark at a certain point. It is a little bit scary, but it's quick. It's a little intense, but I haven't had anybody who couldn't go through with it once they were in the room.
Yeah. Now, what's the recovery procedure like?
Initial recovery is about 3 hours, where your eyes will feel scratchy, burning, a little bit teary. It's important to have somebody drive you home after the treatment.
Got it.
Even though your vision is a whole lot better right after than it was before, you really shouldn't attempt to drive afterwards. The next day I see patients back for the 1-day follow-up. And as I mentioned, everybody I've treated has been able to drive in for their 1-day follow-up. You can go back to work the next day as long as you stay out of dust and dirt. Use proper precautions. Don't go to the gym. Don't get sweat dripping in your eyes. don't use like weights that are dirty, rub your eyes,
Got
or
it, yeah.
that type of thing. And you do have drops that you'll be putting in for about 2 weeks afterwards.
Now, you mentioned a few things like, dust, maybe avoiding touching your eyes after you're out. Is there any other specific things that patients need to avoid right after?
You shouldn't take a shower or wash your face immediately after the treatment. When you leave the procedure room, I put little plastic goggles on your eyes. You can see through them,
Okay.
but it's a protective thing so that it reminds you not to rub your eyes, especially when you sleep. You need to stay out of swimming pools for about a week.
Okay.
Don't dunk your head underwater. Like if you're going surfing, don't do that for a month.
And how do you determine if a patient is a candidate for LASIK?
First of all, it's the age. They have to be over 18. They have to have stable vision. So I judge that when they come in for the consultation. I check the strength of the eyeglass prescriptions that they bring in, their contact lenses, make sure that it hasn't changed by 0.5 diopters from last year to now.
Okay.
And then they have to have eyes that are not particularly dry and surface of the eye that's normal.
And as you get older, is there an age that maybe you have to, approach LASIK a little differently?
I always make sure that a person has healthy eyes before doing the treatment. As you get older, you could get conditions such as cataracts that could impact the quality of the results. But with the reading problems, I have people coming in specifically for age-related reading problems,
Okay.
and we can treat that as well. So there's no limit.
Is there any cons you would say to LASIK surgery?
Sometimes people can get a dry eye that can go on for a month, sometimes even more than that. So I screen a patient beforehand to make sure their eyes are not dry initially. So that would be one of the issues. And if a person does a lot of night driving, sometimes
Yeah.
they can have halos, glare at nighttime. It's unusual now with the new technology.
We'll be back after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on LASIK eye surgery. I imagine the price can vary a little bit for LASIK. Is there kind of like an average price you would say in the Los Angeles area?
It's usually around $4,000 to $5,000 for both eyes. That's the
Okay.
typical price range. It does depend on the technology that's used. The newer technology, it's like anything, it's going to cost a little more if you want the newer version of the lasers, the eye design, for example, which is what I use. I do all of the follow-ups myself, so I don't pay any other doctors or associates to see you before the treatment or to assist in the procedure. So that kind of tends to I pass that saving on to patients.
What kind of financing options does your practice offer?
Financing, of course, they can pay with credit cards, and that's not an issue. A lot of people come in, they want to get their air miles and that type of thing. That's understandable. Also, they can use a flex spending card. So the savings cards that you get, the health savings card, the HSA features that they have at their employment. And we deal with a lot of outsourcing financing companies such as CareCredit, which really makes the payment affordable.
I imagine it must be really rewarding restoring people's vision. Is there a memory or a story that comes to mind?
Actually, there is. The most memorable one was a young girl who came in. She was just 17.
Okay.
And she came in for a consultation. I said, unfortunately, I can't treat you until you're 18. It's the FDA requirement. She said, yes, I've looked into it. I turn 18 next week. And she wanted to have PRK treatment, which was a form of LASIK. Her goal was to sign up for the Navy, and she wanted to be a drone pilot.
Wow.
I had no idea that a drone pilot, even though they're not sitting in the drone, they have to have 20/20 vision. So she was motivated, going to get PRK done, become a drone pilot, and she did it. Amazing.
Wow.
So turned 18, we did the procedure, and she went on with her life choice.
So now we're going to do something fun. It's called the rapid fire questions.
Okay,
Myth
exciting.
or fact, okay? So the first one, myth or fact, if you get LASIK, you'll never need glasses again.
That, unfortunately, is a myth. The goal, of course, is to get rid of glasses and contacts for everything, but sometimes depending on the visual requirement. If a person needs super, super good vision for close-up, sometimes you have to sacrifice a bit of the distance vision.
The next one, myth or fact, if you have astigmatism, you can't get LASIK.
That is a myth. Astigmatism has been treated for the past 25 years extremely successfully, and it's treated at the same time as your nearsightedness or your farsightedness. Everything is all treated together with the custom lasers we have now.
And the last one, myth or fact, LASIK surgery takes a long time to recover from.
Another myth.
Yeah.
The initial healing is 3 hours, and everybody I've treated personally has been able to drive and go back to work the day right after the procedure. So extremely fast. Final healing is at around 1 month, where you can swim with your eyes open underwater. Very quick healing. I have people flying in, they take for their procedure, and they fly home the same day.
Dr. Chebil, thank you so much for being with us today. You were so informative, and I've learned so much about LASIK eye surgery.
Oh, thank you for having me. Very good topics.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.
Through October 31st, 2023, earn an entry for your chance to win $5,000 in the Let's Get Digital sweepstakes. Enter the secret word EYES in the Sweepstakes Hub to earn one entry now. Head over to the Sweepstakes Hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. Legal residents of the 50 United States, D.C. and U.S. territories, 18 years of age or older, who have a CareCredit credit card as of 9/12/2023. Void where prohibited. Starts 9/13/2023, ends 10/31/2023. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank.